Well, the Ebola virus has claimed scores of lives on the continent over the years. It's been declared a national emergency now over the latest outbreak in Nigeria. Now we cross to Wole in Nigeria. Good morning to you, Wole. I suppose the update here is that a state of emergency, or rather a health state of emergency, has been declared. What has changed? What has happened to prompt this? And what will happen as a result of this declaration?
Good morning, David. Of course, that is the biggest news in Nigeria right now, the Ebola virus. Clearly a big issue in West Africa, but Nigeria's health minister yesterday declaring that it is now risen to a state of a national emergency. Now, what that means, it's not very clear. What we know, definitely, where there's a state of emergency somewhere in the country, it really revolves around troop movement and just making sure that there is security in that area. But then this is different because this is a national state of a national emergency related to a health issue. And of course, this has been prompted by the latest news around the Ebola scare in Nigeria. The latest that we can confirm is that, according to the health minister, one Nigerian has now died as a result of contact with the Liberian that more or less brought this into Nigeria. We do know that several weeks ago there was a passenger who traveled from Liberia into Nigeria, and as he landed, he was quarantined, but unfortunately, apparently, he was a carrier of the virus. He has passed on, and apparently some of the nurses that were treating him were also have also contacted the virus. Indeed, what we're hearing is that as many as 7 confirmed cases related to that traveler and 1 fatality. So it just really elevates the discussion in terms of the importance of how Nigeria tackles the Ebola virus and its impact on the population here.
Yeah, looking at the cases that have happened, what we do know is that it's not airborne, so you can't catch it by sitting next to someone and not being in contact with them. So contact is the key here, and one wonders if part of this Nigerian emergency power issue is to say, do they have emergency powers to quarantine people, for example? Can the army quarantine whole areas? So there might be issues of individual rights being overcome by the government, the state, saying we need to act to protect other people. Because the number of cases isn't that great. It's the fear of it spreading further.
Absolutely, it is that fair, and the government more or less making a major statement saying that this is a big issue and we're going to deal with it. You mentioned troops perhaps quarantine, putting people together. We've seen that happen in Sierra Leone and Liberia already. Of course, those are the countries that are perhaps hardest hit. The fatalities continue to rise, unfortunately. Well over 900 fatalities related to Ebola. Thousands of people already confirmed to be carriers of the disease. As we know, the mortality rate right now is unfortunately not very good. Well over 50% of the cases relate to deaths with respect to Ebola. And I think when you look at Nigeria, when you look at the medical facilities and how Nigeria can deal with this crisis if it were to spread from Lagos, because right now that's what the minister has said. It's confirmed that it's only in Lagos at the moment. We have heard reports and rumors that it has spread to other parts of the country, but according to the health minister, it's still a Lagos issue for now, and only 7 confirmed cases relating to Nigerians. But of course, if it were to come out of Lagos, then it's going to be a big issue to deal with, because the medical facilities are either not there in Nigeria or they're just not affordable for most people. Ebola is such a quick killer that if it were to spread outside Lagos, I think a lot of people will be worried.
Well, I suppose the high consciousness through the declaration of an emergency, and the whole country must be aware of this now. Everyone must be aware of it by word of mouth and through the media. Now, there is talk of experimental drugs that possibly are working on 2 Americans who have been infected. Now, President Obama himself has said that he's reluctant to distribute these drugs until the trials have proved that they're effective. He says the countries affected by Ebola are the first to admit that what's happened is that the public health systems have been overwhelmed. They weren't able to identify and then isolate cases quickly. And he says as a result of that, the Ebola virus has spread more rapidly than has been typical in the past. So I suppose that raises the question, even if you have an emergency, they can't wave a magic wand and suddenly improve the public health system and the screening and the isolation techniques. It's going to be very difficult apart from raising consciousness.
Absolutely. I think that is the big concern of most people in Nigeria. If it were to spread, especially out of Lagos, I mean, it could be a big issue to deal with here. And of course, the Lagos State Governor has also added his voice to this issue. He has suggested that perhaps we should close our borders, given the threat level across West Africa right now. As we know, it's really the biggest problem is in Guinea, Sierra Leone, and Liberia. So far, there have been no reports in terms of carriers or people being infected in countries like Ghana, Benin, Togo. Of course, these are countries that are really close to Lagos, and we know that those borders, especially the Nigeria-Benin border, is really porous. I've been there. I can imagine that it's easy to contact a virus if it were coming in from those borders. So that just elevates the conversation in Nigeria right now. Even the state government is putting its voice in. The Commissioner for Health in Lagos has also called for help, because if this were to become a bigger issue, Nigeria is just not prepared to deal with it. So they're calling for help from all over the world. We're looking for health workers, nurses, whoever has some expertise or training that can support Nigeria in dealing with this crisis. It's still a threat. I think that is the way it's been considered. Like I mentioned, only one fatality so far, but many people suggest that we need to get ready just in case this gets a little worse.
Yeah, I do know the South African Health Minister has promised a mobile hospital. I'm not sure what the scale of that hospital would be. Well, how are people behaving? Because the danger in a situation like this is that people panic. There was a picture in one of our newspapers of a man lying in the street in Lagos. Not clear what was wrong with him, but people just kept away from him in case he had Ebola. So he lay there for several hours, not clear how well he was or how bad he was. So the danger is that the public panics, and you have other consequences, bad consequences, of course, which have nothing to do with the virus itself.
Well, I won't call it a panic right now, but definitely many people are concerned. They are watching the news, they are following the stories, they are trying to get the latest updates from the authorities here, especially the health minister, who of course is engaging the press a lot more these days, and we're expecting another engagement later on this afternoon. So definitely a lot of people are concerned. There's definitely that conversation, even amongst colleagues in the office, about hygiene, personal hygiene, washing your hands, etc. So more people are concerned about what could happen, and while they continue to track the news, they're just trying to elevate their safety levels in terms of their personal hygiene.
Yeah, I think we have to reiterate again that it's not something you can catch through the air. It comes from personal contact with people who are infected. Thanks to my colleague for now, that's Wole, for giving us an update there on the Ebola outbreak.